Come in.
Hi.
Hello.
Hello. My name is Katrina. I'll be your nurse today.
Hi, Katrina.
I've brought my equipment with me. Let's see.
Okay.
Let's take a look at the. I'm going to do a little safety sweep of the room. I see that the bed is locked and in low position. I see an IV pump, but there's no IV attached to you. All right, great. And I do see, and I'll be checking on this before you take off, that we have a call light available to you to call for assistance. All right, so taking a look at that. All right, let me start cleaning my equipment and I'll chat with you.
Sounds good.
If you weren't here today, what would you be doing?
I'd be at home with my husband.
Okay, wonderful. Aw, that sounds very nice.
It's a good day to have coffee and talk.
That is a lovely way to start the day. And speaking of that, what day is today?
Friday.
Okay, perfect. And I need to ask you your full name and date of birth.
Susan, and that's my date of birth.
Okay, that matches the medical records I came in with. That's excellent. All right, person, place. Where are we right now?
We're in the skills lab at OHSU.
We are. That's great. And what is the reason that you're here?
Oh, for the free exam that you guys provide.
I'm so happy that we've started doing this. It's a great opportunity, you know, and wonderful for our students.
Oh.
So appreciate you coming. Let's see, there we go.
Thinking I'm getting the benefit of it.
I know, that's excellent. All right, and so home, did you have coffee with your husband this morning?
I did.
Oh, that's great. All right, cleaning, I'm gonna let these dry off just a little bit. All right, so I would have to say, so we're just talking about the general survey. I'm gonna do vital signs. And while these are drying, I'm actually gonna do part of the vital signs assessment, which is to ask you about whether or not you're having any pain.
I am having some pain to the left knee.
Left knee. How long have you had that pain in the left knee?
It's been a couple years.
A couple of years, all right. Is it steady or does it come and go?
There's always some.
Okay, on a scale of 0 to 10, 10 being the worst pain you can think of and 0 being zero pain, where is it for the steady state?
1 to 2.
Okay, 1 to 2. And are there, is there anything that makes it worse?
Yes, twists or just turning wrong.
Okay, sudden movement, sudden
Yes.
surprise movement. What does the pain become at that point in time?
It's sharp and it'll go up to a 7.
Okay, so at the time when there's sudden movement, it's a sharp pain up very high at a 7.
Enough to make me gasp.
Okay, all right. And then the pain that's the chronic pain that's at a 1 to 2, how would
Yeah.
you describe the quality of that pain?
Toothache.
Okay.
Just dull.
All right. Oh, wow, what a way to compare it. All right, very nice. That's a great comparison. All right, is there any treatment, do you do any treatment for your knee pain?
When it's bad, I'll take ibuprofen.
Okay, and that might be after a sudden movement and the sharp onset of sharp pain?
Yes.
So at that point in time, when you take the ibuprofen, what does the pain go down to?
Oh, it drops it down to maybe a 2-3.
2-3, all right. And what is your goal pain? Like,
I'm good with the 1 to 2.
okay, all right. And so sometimes, all right, so it's significant. So after you've twisted it, I hear that maybe even with ibuprofen, it still is more intense for, how long does that last when that happens?
Typically not more than 24 hours or so.
All right, that's great to know. And what do you understand is the reason for the pain that you've had in your left knee?
Multiple injuries resulting in osteoarthritis.
Okay.
So no cartilage left. That's why.
My goodness, all right, well, that explains it. All right, well, thank you for telling me about the left knee pain. That is very significant. All right, I think my equipment is dried. Are you
Okay.
going forward with me grabbing a set of vital signs?
Absolutely.
All right, I'm gonna do your temperature first.
Okay.
Any issues with your temperature?
Nope.
All right, I think we're ready here. I'm gonna put this on your temple and we'll wait for it to register. Great, 98.2, and that's within the normal range for an adult of 99.4 to 96.4 to 99.5, so you're in the middle there. But I would like to check your pulse if that's okay.
Sure.
All right, and great. steady pulse. .68.
Okay.
Nice and steady. The range, normal range for an adult is 60 to 100, so you're on the lower end of that. That's a really nice pulse. Steady, regular, your skin is warm and dry. All right, which arm would you like me to check your blood pressure on?
Let's do the left.
Okay.
Right.
All right.
My
that's
right,
All right.
your
Good,
left.
Good. Whichever one works for you. All right. I'm going to position your arm here with the pillow to have to where I'm checking the blood pressure. It is more even
Okay.
with your heart, and I'm going to check for your pulse. It's wonderful, nice and strong and regular right there. And this cuff tells me for the right arm that I want to have my sphygmomanometer positioned right. Crazy name.
Say that 5 times fast.
Exactly. All right, thank you very much. And then just relax your arm. And what does your blood pressure run normally, if you know?
Under 130/80.
Okay, great. I will pump it up accordingly and let you know. (118/72), and the adult, the below 120/80 is desirable, and that's exactly what you're running.
Great.
All right, so temperature, pulse, and I haven't counted your respirations yet, so I'm gonna save that for, I'll do that shortly.
Okay.
And I'll sneak that up on you so that you don't know I'm doing it. All right, so I'm going to go ahead and move this tray now, and I'll summarize my findings from my general survey. Is that
Okay.
you are awake and alert, you are oriented ×4, you know where you are, who you are, and did I ask you the day of the week?
Yes, you did.
Okay, I'm not oriented ×4. All right, but you are. All right, so that was great. And you had a nice cup of coffee with your husband this
I did.
morning. And here taking advantage of our clinic. I'm very happy that you're here. Vital
know
signs
too.
were all within normal limits. I will let you know about your respiratory rate in just a little bit.
Okay.
But this will give us some information about your breathing quality.
Okay.
And so let me bring this table back and just relax your hand there, and I will turn on this pulse oximeter.
Okay.
And we'll check that. And it's registering that nice, steady, slow pulse. Pulse is 69, and your pulse oximeter is 98, which we like between 95 and 100. So again, really all within normal limits, vital signs. Skin
Great.
warm, dry, pink. All right, so I think that, and your speech is clear. Really just a pleasure to work with, Susan, so I appreciate you coming.
Mutual.
And so what I would like to do now, if it's okay, is to begin a head-to-toe examination.
Yes.
And so to begin with, so we'll start at the head.
Okay.
And so I'd like to ask you, do you have any issues, OMG? Okay.
I saw you do it over there. So.
I've done it so many times. So anyway, so Susan, thank God I touched those alcohol wipes like crazy. It's a little bit of a help. All right. So before I touch you with my whole hand, I've now done hand hygiene. So any issues with your skull,
No.
any lumps, bumps, sore spots, any issues with like rashes or anything, or
No.
Skin of your scalp? May I take a look?
Yes.
All right, so I see your hair is nice and clean. I see, and I feel a normal shaped, I feel no lumps or bumps, anything unusual with the shape of your head.
Okay.
Skin over your head is really great, pink, dry, warm. All right, so that looks great. All right, moving down your head, I'm gonna ask you to raise both eyebrows. All right, great, that's checking. I'm gonna do a few things that check your cranial nerves, and then we'll talk
Okay.
about the nerves out in the rest of your body. All right, so that was great, equal movement of your eyebrows, and I'm gonna stick with your eyes now, so I'm going to ask you about your vision. How is your
It's
vision?
good with glasses.
With glasses, and you're not wearing glasses today?
No, because of the shining light.
Okay, oh, that was very thoughtful of you. All right, so what I'm gonna do now is take a look at your pupils. They are equal and round. I'm gonna shine a light into your eyes, and I'm gonna watch for the pupil nice constriction. I'm gonna let them come back, and there's a nice constriction on this side. All right, so your pupils are equal and round. They react to light the way I expect. I'd like to check for distance accommodation.
Okay.
So what I'll have you do is I'll ask you to look at the tip of the pen, and then look at those beautiful yellow leaves outside there.
I do love that.
They're gorgeous. It's a nice thing. All right, so I'll have you, I'm gonna look at your pupils while you are looking at the tip of the pen, and now look out at the leaves. And your pupils dilate nicely as you look off in the distance, so that's accommodation. All right, now, before I'm done, I'm
Okay.
going to look for, again, this is another check of your cranial nerves. I'm gonna have you just follow the movement of the pen.
Okay.
All right, while you hold your head still. All right, moving up and down, to the side, great, to the diagonal, and the other side. Great, diagonal and diagonal. Your eye movement is smooth and complete. There are
Excellent.
no limitations that I could see. All right, so moving our way down, let's ask about your nose. How is the quality of smelling for you?
Good.
Any difficulties breathing through your
No.
nose, one side or another? Great. The skin over your nose, anterior, on the outside looks normal. If you don't mind, I'll look up inside, and the mucous membranes are moist and pink on both sides, no obstructions or anything, looks clear. All right, and you sense it. All right, let's go, we'll move sideways. How is the quality of
Oh.
your hearing?
It's good.
Great. And any issues with the skin around your ears?
No.
All right, and so I'm gonna just look at the external structures.
Okay.
All right, and so I'm gonna look here, and the ear canal is normal, no unusual, in fact, no secretions at all. And same on this side, dry skin is warm, pink, warm, dry, no issues there. External structures, all right, let's go ahead and we'll talk about, let's go ahead and do a big smile. Great, and then stick your tongue out and move it side to side. Great, perfect, that movement is smooth and equal. Any issues with the mucous membranes inside your mouth?
No.
How about dentition? Any?
No.
All right, great, so if you don't mind, I'm gonna shine a light. I'll have you open your mouth and say ah for me.
Okay.
Great, say ah.
Ah.
Great, that looks good. Mucous membranes are moist and pink, one more time. And I see no lesions or anything along your mucous membranes. No bleeding or anything either. How is swallowing? Any difficulty
No
swallowing?
problem swallowing.
Great. If you are good with it, I will go ahead and I'm gonna feel while you swallow.
Okay.
All right. And so I'm gonna just put my hands on either side. I'm gonna have you swallow. I feel good movement and equal movement of your trachea, and I didn't feel any differences. Anything I should know about your thyroid? All right, let's do strength. I'm gonna put my hand here, push, great, and the other side, push, equal strength on both sides. While we're doing that, I'm gonna shrug up against my hands, nice, equal, strong on both sides. And then what I also would like to check related to your neck are lymph nodes.
Okay.
Any swollen or sore
No.
lymph nodes? All right, great. I'm gonna check along behind your ears, along the jawline. I don't feel anything. I'm gonna feel down along the neck and kind of across the clavicles here. I feel no lumps or bumps. Any tenderness when I was checking
No.
there? All right, so a perfectly normal head, eyes, ears, nose, throat. All right, good strength, good cranial nerves in the movement of all your muscles related to there, and the skin looks great. All right, are you good with me? What I'd like to do now is do I'm gonna take a look at the quality of your breathing.
Okay.
Anything I should know about your breathing?
I quit smoking about 10 years ago.
Oh my goodness, that was quite an accomplishment. All right, any issues with your breathing now?
No.
Okay, great. I'm gonna have you take a deep breath while I watch my hands move. All right, and take a deep breath with your belly. Great. Good.
Oh,
Great.
yeah.
All right.
See, I want to use the shoulders.
There you go, yes. All right, nice equal movement on both sides as you were taking a deep breath. I'd like to listen to your lungs with my stethoscope now.
Okay.
I'm gonna listen to 3 pairs of sights across the front, and then listen on each side, and then
Okay.
I'll do just slightly more in the back. If, I'm gonna leave my stethoscope in place while you take a full breath in and out. If you get tired and wanna take a break, just raise your hand.
Okay.
Gonna start here. Okay, and on the side. You're great. Great. All right. Really nice breath sounds, by the way. All the way. I'm gonna come around to your back, and the same process, but
Okay.
I'm gonna work down 4 sections down your back, and then I'll listen to 2 places on each of your sides.
Okay.
Okay, again, put your hand up anytime you need me to take a break. Okay. You have clear and really nice quality breath sounds all the way down.
Great.
That is awesome. All right, well, now I would like to listen to your heart, if that's good.
Sure.
All right, I'm going to listen to 4 sites, 5, ape to man, right? All right, I'm gonna listen, I'll announce the valves that I'm listening to
Okay.
as I move through them.
Okay.
And then when I get around to the mitral valve, which is down here on the lower left chest, which is the bottom of your heart, I'm gonna listen for a full minute just to be able to hear how regular your heartbeat is. And so it'll feel like a long minute. All right, so I'm gonna start here. I find your clavicle, or your collarbone. I come down to the first space underneath, and I go to the second intercostal space. This is your aortic valve. Coming across to the second intercostal space on the left, this is your pulmonic valve. Third intercostal space, Erb's point. Fourth intercostal space, the tricuspid valve. And now if you'll move your breast for me, thank you, I will listen for a full minute. I'm just gonna line myself up. Perfect. Your heart rate was nice and regular,
Okay.
and you're breathing 18 times a minute, which is within the range of 12 to 20. So I've completed my vital signs.
All right.
Pair that with the pulse oximeter of 98%, looking really good, and then the qualities of those breath sounds all the way around.
Excellent.
All right, so we have, so to finish the cardiac part of, a good portion of the cardiac assessment, I'd like to listen to your carotid arteries. So I'll
Okay.
feel where they are, and I'll listen over the top for any whooshy sounds that would indicate not nice, something other than nice smooth blood flow. And then I'll listen also with the same place for your aorta,
Okay.
on the stomach. All right, great. So I'm going to palpate, if that's okay.
Mhm.
I'm gonna find your carotid. Great. Perfect. Now listen.
And you're using the bell.
I am. Yes, that's
Ah.
right. Good. Bell for this one. Fabulous breath sounds. And while I've got my bell going,
Okay.
I'll read you and listen for murmurs.
Oh, okay.
What is nice is it's assistive to hear murmurs if you're able to lean forward a little bit
Sure.
while I re-listen to those vowels. I'm going to do the same things.
Okay.
I'm going to find your collarbone, first intercostal space, second intercostal space, the aortic valve, pulmonic, Erb's point, tricuspid, and then if you don't mind lifting your breast, just listen here. I heard no murmurs.
Fantastic.
All right, so what I'll do is I'll combine listening to your aorta with the abdominal assessment.
Okay.
And so if you're comfortable with it, maybe I'll have you lean back in the bed.
Sure.
And put your feet up in the bed, because then I'll be moving on to your arms and your legs. So if you're good with this will be great.
Perfect.
All right, so I'm gonna do a quick little listen for an abdominal burrowing.
Okay.
I hear no irregular sounds that would indicate, like, not nice smooth blood flow.
Okay.
All right, that's looking good. Any issues with your stomach that I should know of?
No.
All right, when was your last bowel movement?
Yesterday.
And great, and then any issues with urinating, frequency or
Nope.
burning or anything?
Nope.
All right, great, and any issues with the skin around your genitals or your anus?
Nope.
Skin of your stomach?
Nope.
Meanwhile, as I moved over your chest and your back, I saw no issues with your skin, so that all looked good. No lesions, nothing unusual, no bleeding. All right, so the first thing I would like to do is just take a look. Your abdomen is rounded, it is even. All right, then I would like to listen to, with my stethoscope, would you point at your belly button for me? Indeed, right about there. And so I'm just gonna follow your large colon, start here in the right lower quarter, and just move along and follow your large bowel.
Okay.
Okay. Great. Good active vowel tones.
That's the coffee.
Oh, excellent. Good news. All right, I'll speed this up. All right, what I would like to do now is just palpate.
Okay.
Just push a little bit with my hands. You let me know if anything is tender, and I'll let you know if I
Okay.
feel any lumps or anything.
Okay.
Okay, all right, here we go. Starting, I'm gonna same position. I'm gonna start and just kind of follow your bowel along. All
Okay.
right. Great. Any tenderness there?
No.
Okay, and that is nice and smooth. I don't feel anything coming across. Any tenderness?
Nope.
Great. And last place. Any
Okay.
tenderness?
No.
Great. All right, nice and smooth. Absolutely normal. All right, looking really good. So normal abdominal assessment, and skin looks great. All right. Now let's go ahead and I'm gonna do the vascular.
Oh.
I'm gonna do a vascular assessment of your arms and your legs by checking
Okay.
your pulses and your cap refill. And so I'm palpating for pulses. And I do have nice equal pulses, and still that nice slow rate. I'm gonna pinch on your fingertip and go in and say we're less than 3 seconds. I'd say between 2 and 3. Actually, probably more like 1,001. About 2 seconds. All right, nice and
Okay.
warm and dry. And let's do strength. All right, so if you would squeeze my hands really hard. Great.
Squeeze.
Pull me toward you, great, and push me away.
Okay.
Nice, equal, very strong. All right, awesome. Yeah, you live on a farm? Feels like it. Great. All right, so let's take a look.
More like a zoo.
Any numbness or tingling on your
Nowhere.
arms? All right, how about on your face or anywhere else on your body?
No.
Any numbness or tingling?
Nope.
All right, and then very specifically asking, any numbness or tingling on your legs?
No.
All right, I'm gonna check your pulses again, so I'm gonna feel for the pedal pulses over the top of your feet.
Okay.
good, equal pedal pulses, and movement is good, toes are, all right,
Oh,
that
yeah.
looks great. All right, I'm gonna do your cap refill over your toes, and that is also similar to your fingers, about 2 seconds. Great, nice and warm, no numbness or tingling.
Nope.
That's accurate, okay, great. And let's do a little bit of strength. All right,
Okay.
if you'll lift this leg, I'm gonna do it for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you're good doing the with the left leg?
Oh, yeah.
Okay, great. Same thing, lift your leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. I'm gonna come around and we're gonna do a little bit of strength. So you did your quad strength. I'm gonna look for, I'm gonna have you push like a gas pedal. Wonderful. And no toes to the knee. Perfect. All right, great. Really good strength. All right, so no numbness or tingling, good circulation, movement, sensation of your extremities. All right, so that actually completes our head to toe exam.
Well, that was quick and easy.
Oh, excellent. And then would you like to, let's come to a sitting position, unless you would like to stay. Would you like to stay? How's your position actually at this point in time? You wanna
Actually,
hang out?
I would love to take a
Okay.
nap.
All right, wonderful. How's the head of the bed? Is it high
It's
enough for
great.
you? Okay, well, that's good. For position, there's no pump attached to you, so no IV running, so I don't need to worry about that. Skin is warm and dry. Pump pain. How about pain after? How's the knee or
No,
any new pain?
it's fine.
Okay. All right, same.
Yep.
All right. Rate it for me again right now.
2.
About a 2. Gotcha. All right. So pump pain. Do you need to use the restroom before I take off?
No,
All right. And let's see. Do you have your phone? Is it handy to you?
I do have my phone.
All right, and then, so periphery, I'm taking a look at everything to make sure you have your phone available, that you have your call light available, should you need
Great.
this. Since you're gonna stay in the bed, I'm gonna go ahead and put up this side rail, because they both have controls, so you can control the head of the bed. And sometimes it's kinda handy to hang on to this when you wanna stand up. The bed is low and locked.
And you're not going to turn on the alarm.
I will not turn the bed alarm on for you because you are fully oriented and very strong. And I haven't done the full test, but I would rate you low on the fall risk currently.
Excellent.
All right, great. Because you're fully oriented. All right, so I think, so what will happen next is that thank you for allowing me to do this head to toe.
Thank you.
And to meet you, it's a pleasure to meet you.
Pleasure to
And
meet you.
all findings within normal limits with the, just your chronic left knee pain from no cartilage. And otherwise your findings are all wonderful. And so the next thing that will occur is that the next provider will come in at about within 10 minutes, they should be here. So I'll come back and just swing by and make sure that that has occurred. But if you need anything ahead of time, just give me a call. You've got your phone.
Yep.
All right, okay, well, thank you so
Yes.
much. It was great
Thank
to meet you.
Excellent exam.
And as I'm heading out, while I was chatting, I actually have to, I'm not gonna leave the room until I have cleaned up my equipment here. All right, so.
That is something I watch for, and I really am grateful that you cleaned it before you put anything on me today.
This is, it is such an important thing, and I really feel like it's something that we do to indicate our regard for our patients, to minimize the type of infection that comes from being in a place, and so
Oh, this really is comfortable. I may take a nap.
I'm really happy about that. All right, placing these as we go.
How many of these do you do in a day?
It depends. I think on average, well, we're kind of new with this clinic, so we're hoping to build the numbers up, so I can't tell you how thrilled I am that you've come in today. But maybe I think we got 15 people lined up.
Wow, fantastic.
I know, so
Such
exciting.
a great service.
I appreciate it. I'm very excited that we get to do this. All right, so there, I have cleaned up my area. There's alcohol wipes, and, all right, I wish you, I hope, how shall I leave the curtain? You want to hold it open?
Please close it for me.
Okay, great.
Thank you.
We'll do that. And great. All right, thanks so much, Susan.
Thank you.
All right, see ya.